fact, right now, time to do the injury report and a lot to talk about around the NFL.
This week's injury update is brought to you by the Jacksonville Orthopedic Institute. JOI is the official sports medicine provider of the Jacksonville Jaguars.
Yes, they are, and we're joined right now by Dr. Kevin Kaplan from JOI. He's also the Jaguars team doctor, and well, we've got him on speed dial just in case we have a question here or there for every day of the year, whether it's about baseball or whether it's about football, and we're talking football, of course. Doc, good to have you on the show here on ESPN 690, and thanks for taking a few minutes out of the busy schedule.
Thanks for having me. How you guys doing?
We're doing fantastic. Brent Martineau, Casey Kurtz, Dr. Kevin Kaplan. How many surgeries you do today? Is it today a surgery day or what?
No, today's half a day seeing patients in the office, and then I'm over at the stadium just at the end of practice on Thursdays. I come by, check the guys out, and do that. Tomorrow's surgery, so I got a bunch tomorrow.
You'd be how many will you do tomorrow? Like, can you give us an idea, or is that too much information?
No, I have about I think 8 scheduled for tomorrow, I believe. So between knee scopes and ACLs and shoulders,
Just a normal day.
That's right, normal day. Hey, no short of business with all the athletes we have around town. That's for sure.
That is true. We've got a lot of them. I'd love to follow Dr. Kaplan around for a day and just see bouncing back and forth between the Jags. He's got a busy schedule. And, hey, the biggest story around the NFL is the Achilles of Aaron Rodgers. And we saw it in Jacksonville. We saw it at that stadium, actually, DeJuan Smoot and also James Robinson over the last couple of years. We've even seen it with Kevin Durant and other sports. I always thought like the Achilles was an older guy injury, so it would relate more to Aaron Rodgers. I don't necessarily think it is. Is it more prevalent now in sports with the Achilles for some reason, or are there just more bigger names or closer to home names that we're noticing it more?
I think it's closer to home. I mean, we see this a ton across all different sports, and the reality is these guys are so big, so strong. And what's happening with these types of injuries is the muscle is firing while the tendon is lengthening at the same time. So if you saw that play in slow motion, you saw him plant his foot, and so as you bring your heel to the ground, and then he's firing the muscle to try to get away from the defender at the same time, something gives. And in his case, unfortunately, it was the Achilles tendon. Sometimes we see that with calves. I mean, Joe Burrow very similarly had a similar type of injury, but instead of his Achilles tendon being injured, he injured up higher up by the muscle, which is where the muscle and tendon meet. So those are typically non-surgical and heal. But I think as these guys are getting bigger and stronger, and yes, certainly age has something to do with it. You know, as we all get older, our tendons tend to get a little bit more worn, and they make these guys that are a little bit older more prone to injury. But, you know, like you said, we saw James Robinson and Smoot had this similar type of injury on the turf in New York, you know, very similar field, same field actually.
We see the recovery time much quicker. I mean, James got back on the field faster. We've seen other players do it. I think in other sports, I think there was like a gymnast coming off the Achilles that happened like almost overnight, it felt like. Why has the recovery time gone a little quicker? And will that be the case for a guy like Aaron Rodgers? I know you're not like boots on the ground there, but this seems like when Larry Bird tore his Achilles years and years ago, like it was like a year and a half comeback.
Yeah, and you saw the same thing with Dan Marino, a very similar injury, I believe. But, you know, I think the way that we fix Achilles these days is better, minimally invasive, smaller incisions. And the whole idea and the key to the success of an Achilles surgery is getting the tension of the tendon correct. And what I mean by that is, you know, the tendon tears almost in the middle, and they almost look like mop ends when they tear. It's not just like someone taking a knife through it. It kind of shreds and pulls apart. In order to get the athlete back to his normal functioning, or he or she, is to get the tension when you repair it right. Because if you don't get the tension right on the tendon, then when they go to push off in the end, they just don't have that same power. And so I think as we've gotten better with our technology, as the incisions have gotten to be a little bit less invasive, we're seeing a quicker return to sport because of those advances in technology. And that's gone a long way over the course of the last 10 years.
Dr. Kevin Kaplan with us from JOI right here on Brent and Friends on ESPN 690, talking some injuries around the NFL specifically. And, you know, Travis Kelce and the Chiefs come into town. He missed last week's game because of a bone bruise. That sounds like in the football terminology world, like, hey, that's okay, nothing big. But obviously it kept him out of last week's game. What the heck is a bone bruise, and how long can some of those linger?
Yeah, I mean, bone bruise is, use the term bone bruise, and it's a very similar to a microfracture. So you have, little small cracks in the bone if you either hyperextend your knee and the two bones collide against each other. If someone hits you in the knee or someone gets tackled into the knee, they can have a bone bruise or a microfracture. And what happens is it bleeds, and it'll bleed into the joint. And then, obviously I don't know the specifics of their injury, but there were some reports out there that he had his knee drained. So we know there was some blood in the joint. And the risk, in reality, is how close that bone bruise is to the articular cartilage, which is the cartilage that covers the bone. And so if someone comes back too quick or really puts a lot of pressure on that cartilage, it can, either further his injury or put him out for a longer period of time. So, it's a tricky play. And certainly if he's, progressing in practice and he's running and he's not swelling again, he's not having significant discomfort, it's something that he could play with. But, the problem is we don't know what his MRI looked like. We don't know where, on the bone that the bruise was, and that all plays into how much it would affect him, going into this week. Whereas last week, bloody effusion, which means swelling in the joint, they drained it, so there's a much more significant risk last week versus this week, and they're probably seeing how he responds to the limited practice before they make an ultimate decision on whether or not he can go this week.
Can you give us a little bit of a sense of who makes the decisions at the end of the day when it's like almost 50-50? Obviously, the coaches are very much involved. The trainers are very much involved. You as a team doctor here in Jacksonville would be very much involved. And then the player I know sometimes you got to save the player from themselves. I get that. Most every player is like, hey, I'm going to play. I understand that part. But how much goes into that decision making? Is it 25% for everybody? Is it more for one person? Is everybody listening to the team doc? How does that work?
Yeah, I think everybody does it different. I know in our organization, the way I've always handled it here is, I want the player to understand the injury. I certainly have a lot of people around them, coaches, agents, family. And every injury is not cut and dry. If someone injures an ACL or tears an ACL, it's an easy decision. If someone has a hit to the knee and there's absolutely no pathology or nothing wrong with the knee, that's an easy decision because there's no injury. But most of the injuries in reality are in that gray zone. And so, the key, and I think for me, is to have the player understand the injury. And then we sit down and talk about what are the risks. And I like to play it out. What's the short-term risk? What's the long-term risk? We lay it all out and then discuss, how things can progress and how we look at that injury. And, it really, to me, it's not 25%. It's I work with our head athletic trainer, Jeff Ferguson, and we sit down with the player and we kind of go over what exactly is going on and is this a playable injury and how could it get worse, or is it okay to play on this? And then we come together and then all make a decision as they progress through the week. If there's an injury that I think is extremely risky or would put the player at risk, then it wouldn't even be a discussion. We would say, Jeff Ferguson and I would say, hey, look, this is a risk. We need to keep you out, whether it's a hamstring strain, that it could get worse. And when we see these guys around the league, that try to get back maybe too quick, or, Cooper Kupp's dealing with a hamstring that's chronic. Those are tough injuries because they can go either way sometimes. So it really is a collaborative effort, and I think educating the players to what the injuries, because some of these guys have never been injured, all through high school and college, and so to get injured on the biggest stage, it's very difficult psychologically. So I think showing them the MRI, letting them understand what the injury is, certainly helps as we progress through the week to whether or not they can play on Sunday.
Dr. Kevin Kaplan with us here on Brent and Friends on ESPN 690. Doc from JOI and the team doctor for the Jacksonville Jaguars. And I guess, by the way, just to follow up with what Dr. Kaplan's saying, is that's why you wait all week and talk it out all week and see how these guys are going, like the Brandon Sheriffs and Luke Fortners of the world, and probably why we'll get more information as we get closer to game time. The other thing that I notice a lot more of the preventative or the precautionary stuff in your field, Doc, the boots. I remember last year, Trevor, obviously I think it was a toe, but even well after the injury, he played on it for a while, still was wearing like a protective boot and I think stem. How much has that kind of stuff changed where you can get these guys into something by the time you're taking the flight home or right after the game and into the next day to enhance the healing process and get you ready almost for the next week?
Yeah, I mean, treatment for injuries like that, and for most of the injuries we see, starts the minute the game is over. I mean, we do a clinic wherever we are, whether it's home or away. try to evaluate, what we're dealing with, whether or not we need an MRI. I mean, sometimes we get MRIs on players as soon as we land from an away game. We certainly have the ability to do that when we're at home. And yeah, I mean, the goal is to, whatever injury is there, whether it's a soft tissue injury or a sprain of a ligament, there are definitely a lot more modalities, which meaning laser therapies and ultrasound and e-stem, and there's the technology every year. I mean, there's something new that we look at and evaluate in terms of trying to treat guys, because I mean, a week turnaround. I mean, if you or I were injured, playing softball or pickleball or basketball, I mean, we have all the time in the world to get things to heal. We're not getting paid to play sports, but for these guys, every week is an important week. And for the team as well. And so, we're trying to treat things to the best of our abilities, trying to get soft tissues to quiet down. Things get inflamed, your body reacts. And so something as simple as an immobilization or putting something in a boot for even a limited period of time can make a big difference to get the swelling out from the minute the game's over until we start practicing and playing the next week. So we are on a constant, carousel of treating injuries and letting guys play if it's safe throughout the entire season, hopefully taking us deep into the postseason.
All right, last one for you. Dr. Kevin Kaplan from JOI on ESPN 690. The biggest story around the league, obviously, was the Aaron Rodgers injury, but then it morphed into a turf versus grass story. How much input do you have in that in terms of people around the NFL or organization asking you, how healthy or how safe or what's the difference? Do you have an opinion on it? Is there factual information on it from your standpoint of someday we'll be playing on all grass fields, or how does that factor into what you do?
Yeah, I mean, it is a constant discussion, and certainly listening to the players and listening to how they react to the turf and their feet getting stuck in the ground. I think the literature is mixed. I mean, there's some literature out there that certainly shows, the risks of playing on turf versus grass. Others don't really show as much of a significant difference. But certainly when you look at an injury like that, and then anecdotally for us to have two Achilles on the same field, the 2 years prior, we always are evaluating, and I think the NFL safety committee is definitely takes part in those discussions. We have a physician society made up of all of the team physicians from around the league, and we get together every year at the combine and look at the data, look at the ACLs, look at the high ankle sprains, look at the Achilles injuries. There's a foot and ankle committee. So all of that we are constantly evaluating, and I think we've made huge leaps and bounds over the last 5-10 years, at least since I've been around, in terms of player safety and health and safety, and that goes from concussions in the head all the way down to the feet. So I think that's also constantly evolving, and this is going to be brought up, and certainly brought up by the NFLPA and the NFL Physician Society, NFLPS. So every year at the combine, we're going to continue to reevaluate, and I wouldn't be surprised if there are changes. I just don't know how and when, and there's a lot of people that are involved in those decisions. But very important to try to keep our guys healthy on the field.
Dr. Kevin Kaplan from JOI with us on ESPN 690. We'll visit with a doc from JOI each and every week here on Brent and Friends on ESPN 690. All right, keep them healthy this weekend. We'll see you Sunday at the bank, man.
Let's do it. Go Jags.